Coming to the survey results, Belongg conducted a survey all through May, which we call the Identity and Mental Health Survey. The survey really tried to explore the intersection of mental health and identity and the challenges that are different and unique and the need for customized mental health services. Nirat, our founder, would moderate this and read out the survey results and show you some slides. Nirat, over to you.
Thanks, Lasya. And welcome back, everyone. Excited to present, like Lasya said, some fairly draft and interim results from the survey we've been running in May, and that will continue for some bits in June. Just before I bring up the slides, the intent was to actually try and figure out 2 or 3 things about the mental health therapy experience for people with such identities. The first was just to understand how did they go about seeking therapy? What were the patterns of use of therapy? What their satisfaction really was, and what were the key impediments they perceived while engaging in therapy, and was it really useful or not? We managed to get close to 100 responses, some really qualitative, a lot of qualitative depth in some of these responses. So we will be formally presenting this, converting this into a white paper, and we'll release it closer to the end of June. But we are taking the opportunity of this festival just to present some interim findings, which might be really useful as starting thoughts for the segment that we have right now, and even the subsequent segment of designing ideal therapy. So if everyone can see my screen, Lassi, can you see the screen?
Yes, we can see the screen, Neera.
Okay. Excellent. So I'll just quickly run through these slides in no more than 10 minutes, and happy to take 1 or 2 questions after that, and then I'll pass it back to Lasya. Just a little bit about the age distribution. This is just the participant sort of profile. A lot of people in their, let's say, 18 to the 35 age range, and some people from the mid 30s to mid 40s. The identity markers that people felt were responsible for a lot of discrimination that they experienced was gender. Gender stood out as number 1, and then at number 2 there were 3 or 4 different identity markers that people felt to be very problematic. One, physical and mental disabilities. Second, sexuality, and third, relationship status. And there's some really interesting comments participants have left in the survey. Then the kind of conditions that people were trying to address through therapy, by far, almost 80% of people said that anxiety, depression was about 70%, and fear, loneliness, and post-trauma stress were the next set of conditions that people were trying to tackle through therapy. In terms of how they were addressing this, the kind of therapy they were seeking and they were using, counseling stood at number 1. Almost 50% of the people went to a counselor, whereas psychologists and psychiatrists were at about 30%, and psychotherapists at a little below 30%. Then we looked at what were the patterns of these therapy sessions. Most of these were in-person individual sessions. Almost 75% of people only used that, but there was a minor sort of set of people, about 15% of people, who had been using some virtual one-on-one sessions. Very few group sessions, either in person or virtually, were being used. The other thing that we found was that most people over the last 3 or 4 years had only been to one therapist, right? And at most 2 or 3. So people weren't skipping around many therapists. They were sticking with who they found, and which is kind of linked to the question of why this was the case. How did people find therapists, right? And I'll come to the results in just a bit. But a lot of people said that they weren't able to find an identity-friendly therapist at all. Some people said that they could hardly attend a couple of sessions before there was conflicts in opinions. Issues came up in the first few sessions, and then they stopped going to therapy. Some people relied on friends and their social networks, and some were lucky to find about groups like the Blue Dawn, and through them got connected to inclusive therapists. This number 6.2 is the overall rating. I think it's a very telling number. This was the overall satisfaction that people said they experienced with their therapy experiences. So this is a middling number. There was a fairly large variation here. A lot of people had fairly poor experiences, and there were some who had better experiences if they were lucky enough to find an inclusive therapist. Uh, what are the we asked them what are the challenges they felt therapists face while addressing identity linked discrimination issues, mental health challenges that originate from identity linked discrimination. And a lot of the stuff that came up has already been discussed in the earlier segment today. One is just a lack of personal lived experience. So most of our respondents said and they also some very rich and telling quotes that the therapists actually don't have a personal lived experience of that identity, and that really is limiting in how much they're able to help. The second sort of driver which was mentioned was a lack of training in identity linked mental health. And this again, I think, came up. Rashi was talking about this, how in many training programs or professional education for therapists and psychologists, identity is treated at the margins and it's almost an afterthought. And this sort of shows in what our participants also experienced. And then slightly more problematically, almost 40% of people said that they had experienced overt and covert biases held by the therapist, and also if not outright biases, then at least deeply held opinions that reduced effectiveness of the therapy session. Right, it reduced the ability to listen to the patient, and a minor fraction said that there was some fear of social censure if they were to tackle patients with certain identities. Lastly, and this is something I think will segue very nicely into the next into the panel discussion. The question really was what could be done to make therapy more effective. Lots of things around strict standards and training for therapists to see different kinds of clients, to see queer clients, for instance. Also understanding the importance of lived experience. Some self-reflection where therapists learn to identify bias that might exist within themselves, to engage more actively with a learning mindset around these issues of identity, and then lastly, redirecting to other therapists who might be better prepared to address these issues if a certain therapist feels that they're not adequate or fit for task. So this is still a work in progress. We will have more to share by the end of June. But I thought this would be interesting to report out in any case, as it blends very directly into the discussion today.